Namaste all. So the next disease in the Vata Vyadhis which we are learning is Hanugraha. So what is Hanugraha? It's kind of similar to Manyastambha in a different location. So the disease in which the jaw gets locked or there is difficulty in moving it is called as Hanugraha. So Hanu is the uh, jaw basically, and graha is stiffness or uh, being locked. Okay, that's graha. So the disease in which the jaw gets locked or there is difficulty in moving it is called as hanu graha. Okay, the joint gets dislocated and the mouth either stays open or closed and the patient is unable to do any activity of the joint. So why there is locked joint? So at times this is the joint. It is called as the uh, temporomandibular joint. Okay, which connects two regions. Okay, two regions: the temporal region and the mandibular region. Okay, so this TMJ or the TM joint, temporomandibular joint. This joint is like this is the mandible. It has a protrusion and it locks in this, and it easily dislocates. It can dislocate very easily. However, it doesn't happen very frequently. But the strength of the joint, okay, strength of the joint is not so much. Okay, so it can dislocate and it can be brought to the place also easily. So uh, the physician or the treating doctor or the practitioner just holds the mandible, takes it behind and fixes it. So the fixing is pretty easy, of course, but unless you are skilled at it, it is not. Uh, it cannot be done easily. So the process is easy. You have to be skilled at the process. So the joint gets dislocated and the mouth either stays open or closed. Okay, so when it is locked, it dislocates. The movement of the joint does not happen. So in the dislocated uh, state, either the mouth may tend to remain open or closed. So when it is closed, it is not uh, naturally closed. I mean, the mandible will come out and the teeth below will be out and on the above will remain in. So there will be a gap here. Okay, so even if it is closed, there will be a gap. Naturally, this is the uh, state. Okay, this is how it is now. And when it dislocates, the upper teeth will be inside and the lower teeth will be outside. Okay, so even if it is closed from outside, it is not touching each other. It is far apart. Okay, because the mandible has got dislocated and it has come out. Okay, so the dislocation uh, can happen here. Now, in dislocated state, either it can remain open or closed. Apart from dislocation also, at times there would be pain. uh, Hanugraha can still happen without dislocation. Now that can happen because of what are the hetus we will see, but when the when we see the definition, graha, stiffness or difficulty in moving the joint is is the ultimate thing which happens. Okay, so dislocation is majorly the reason. However, apart from that, sometimes Anugraha can still happen. How? We will see. Eating, chewing too hard or dry food items. Too hard. So, this may happen intentionally or without intention also. So if there is too hard a substance which the person is trying to chew, uh, there can be damage to the joint. If it is happening in the center region, it is still balanced. Suppose now I'm just holding this. If this is held in the center region, then there is equal force from both the sides. But if it is chewed from one side, which usually, if it is a hard substance, trying to open a bottle, for example, uh, so the lid or uh, the lid of the bottle is uh, tend to open it with the teeth. This can happen because the hanugraha can happen because the pressure is coming on one side. So this joint is bearing the pressure, and the pressure is not equally distributed. It is on one side, and then the mandible tends to shift tends to shift in order to bear the pressure, and it is open. The mouth is more open on this side, and as uh, the pressure is applied, uh, the joint tends to move on the side where the pressure is applied more. So if it is this side, then the joint will tend to open this side. If it is this side, then the pressure, uh, the mandible will tend to move on the other side. So when there is something hard which somebody is trying to open, or hard to chew, which is big, and trying to crush it with the teeth, and if it is on one side, not in the center but on the sides, which usually happens because our bigger teeth or on uh, the bigger teeth are on the sides. So hence, people tend to chew it with the bigger teeth on the sides, and hence, without dislocation, also damage to the uh, joint can happen, and pain in that uh, TMJ, or you see temporomandibular joint, can happen. So that can also lead to hanugraha in as a symptom or as a disease, I should say. So eating or chewing too hard or dry food items is one of the hetus. Trauma to the joint, temporomandibular joint. So trauma, external trauma. So boxers, for example, they can get hit. Okay, so this is like professional um, players, sports people, wherever there is involvement of punching to the face is involved, there this can happen. And of course, this can happen in any other sport where the damage or there is impact on the joint. This can happen. Apart from that, accidents, of course, will be there. So the external trauma is one of the causative factors. Suddenly trying to open the mouth too big. So the patient is not uh, used to open the mouth so wide, and the uh, the patient or the person tries to open it more than the usual size, then that the joint. So when you open it more, there is a tendency of that. Uh, as I said, it is not. It is just interlocking joint. It is not tied. It is an interlocking joint. So as it moves more, this can dislocate easily if it moves beyond the capacity. Okay, fractures, etc., forget. So that is a different thing. But even normal joints which are intact and the patient tries to move, open it more, then the dislocation can happen. However, without dislocation also, the pain to the joint can still be there, and the muscles around. Okay, so there are muscles around the joint which can cause pain. Suddenly trying to open the mouth too big. So here locked jaw also can be seen, locked jaw, in which the mouth is open. Okay, here we saw the joint gets dislocated and the mouth either stays open or closed. So when the patient tries to open it more wide than the usual, then in that case the joint jaw can get locked and the mouth will remain wide open. So in that case, fixing the joint first is the first step, and then the rest of the uh, treatment will follow. Okay. Hetu 7 Vata Prakop causes dislocation of the TM joint and Hanugraha will happen. Now here dislocation of, as I said, majorly, so 95% of the times dislocation would be seen. Uh, and at times the dislocation uh, would settle on its own as well. So if suppose the mouth is wide open and the patient does some movement, doesn't know what is to be done, but in order to bring it back to normal, does some movement and the joint suddenly goes back to its natural or normal position, the dislocation is corrected. However, the pain and the stiffness will still remain because it has got some damage. It has got some damage due to the dislocation. Okay, so the dislocation, even if it happens or when it happens, can go back to normal on its own if the patient tries to do something and it suddenly goes back. The patient, in order to do some movement, in order to make it normal, can damage the joint further without it going back to normal. So the damage will still happen, but the dislocated joint is still there. Okay. So two things can happen. The patient tries to uh, take it to normal. It goes back to the normal position. Pain still remains. Patient tries to do something, is not able to successfully take it back to normal or do it normal. Damage is done. The joint is still dislocated. Okay, so when it is dislocated, the first step is to fix it, fix the joint. Okay, it looks easy as a process. It is like just drop it down, push it back, and it will just go and uh, settle in its normal position. The process, as I said, sounds and looks also very simple. However, when you actually do it on a live patient, when the patient is screaming and has severe discomfort, the overall situation becomes very difficult to tackle at times. Okay, so when you are doing it, if you are confident of doing the dislocation or doing the uh, manipulating the joint properly, only then you do it. Else it is better to refer it to a surgeon or orthopedician and get it done. So you can say that once it is done, you can come back for whatever other treatment for pain, etc. is there, which is a bit challenging because if the patient goes to the Western medicine doctor, naturally they will give painkillers and antispasmodics, etc., etc., in order to alleviate the pain. Now, those kind of patients, when they take Western medicines and they feel normal, after 10-15 days or 1 month or 2 months, they can come back and say, I still have pain while chewing, or I still feel that pain while I am opening my mouth, trying to open my mouth wide, or while chewing, I have that pain. So that time you can certainly do whatever treatment we are recommending now. Okay. And apart from that, if you are able to manipulate the joint properly, and if you are able to do that maneuver easily, then it is easy for to move on to the next step of the treatment. So in rope, the patient is unable to open or close the mouth when there is dislocation. The movement of the TM joint is painful. Okay, so even if the dislocation has come back to its normal state, but the movement is still painful. Pain while talking or chewing food. So whenever whatever movement or whatever activity requires movement of the mandible, be it talking or chewing food, becomes a painful activity or process. So chikitsa of Anugraha, Snehana with Narayan oil, Swedana, Nadi Swedana with Dashamul. Now when you do Nadi Swedana with to Hanugraha, especially uh, to the temporomandibular joint, you have to be careful that you do not damage the eyes. So close covering the eyes is good or is safe to do, and be specific while you do the nadi swedana in that region. And nadi swedana is the only thing which can be done. Okay. Apart from that, if you want to do hot water, like the towel, hot water towel, that still can be done. Nadi swedana is more effective. Gandusha, sesame oil, Narayan oil, or Bala oil. Just sesame plain oil also works very well in Gandusha. Last week I saw a patient. So she did have similar Hanugraha, and so it was not really Hanugraha as such. She had pain, just mild pain, and she complained that it does not happen too frequently. However, it happens. So then we asked her to do Gandusha with sesame oil. Now let's see, she comes back. She'll come back for the follow up, then we'll know. But external oleation and Swedana, etc., has been already told. So Gandusha we recently started. So just Snehana Swedana we did because the intensity of and the frequency of the pain was not much. Hence we started with Snehana Swedana first. But when she said that it is not completely subsided, then we asked her to do Gandusha. So let's hope that she comes back uh, saying that it is completely cured now. So Shamana Chikitsa in Yogaraj Google for ready preparations. Yogaraj Google, Vata Vidvams and Yogaraj Google are both are pretty common while you do Vata Chikitsa. Okay, Yogaraj Google and Vata Vidvams. When there is presence of Ama, Samir Pannag, Mahayogaraj Google, they will help in digesting the ama, pacifying kapha if there is anubandha of kapha. In Anuloma, Gandharva Haritaki Chikitsa, so Graha, we need Anulomana of Vata and pacification of Vata. So Anuloma Gandharva Haritaki certainly helps. Vata pacifying food and lifestyle, snigdha, soft, warm, semi-solid food, of course, because the patient has difficulty in chewing so warm food. is good. And even in semi-solid, I usually prefer slurry, so that it is just without even chewing the food, the patient can just swallow it, so that there is no pressure uh, on the TM joint, on the Hanu, so that the healing can happen faster. Okay, and warm food will of course help to keep vata in place. And if there is pain, warm food will certainly help in alleviating pain. Similar happens with Gandusha. Gandusha is given in order to pacify vata. So pain also gets subsided, and the stiffness both get subsided with the Gandusha. Okay. And even after treatment, we have to tell the patient that immediately they cannot start eating what is it called, hard food. So they have to, from semi-solid or slurry to semi-solid, then to solid. So even in solid, softer solid should be advised and recommended, and keep applying oil externally with warm water shower will take care of. So the strength of the TM joint, giving strength to the TM joint on a longer basis will help to heal it faster. Else, that pain remains for quite some time. Okay, and patient sometimes feels that it is pain related to the ear. So sometimes it may happen that the patient has chewed something hard and does not know that she has or he has damaged the joint, and feels some discomfort and pain in movement. So they can mistaken it to ear pain, and they may come to you for ear pain, or they may go to ENT and show for ear, and then they realize there's nothing related to the ear. And then if the ENT doctor asks, okay, did you eat or chew anything hard, or was there a trauma? And if they're able to recall that, yeah, I did chew something hard, then it is easy to relate to the pain and diagnose that, okay, this is related to the TM joint, nothing related to the ear. If they come to you, then questions is going to be Darshana, Sparshana, Prashna, Pariksha will help, uh, and that will give you hints of what exactly has happened. In Apatya, Vata aggravating food and lifestyle should be avoided. Hard to chew food should be avoided. Too dry, ruksha food should be avoided. Cold food, fluids, cold air exposure should be avoided. In fact, these patients also have sometimes difficulty in brushing the teeth. So that also becomes a challenge at times. So eventually, gradually, as Gandusha, uh, after 4 or 5 settings of Gandusha, then it becomes easy, and then they can start brushing their teeth also. So it's not that you tell them not to brush their teeth. However, they may complain that we have difficulty in breathing the teeth, because the brush also tends to go uh, in the inner region. So inner region, if it touches the region behind, then it can cause some problem or pain, in fact. Okay, so that is about Hanugraha. Hanugraha also uh, at times can happen due to heavy lifting of weight. Okay, so even if it is like professional lifting of weight, or all of a sudden lifting something heavy. So the strain usually when lifting heavy weight comes on this part, on the neck part, on the lower back part. Okay, so those muscles in those regions tend to become stiff in order to bear the weight. So at times patient tends to develop pain in the Hanu region while they are chewing. They may feel the pain also. So uh, severe lifting of severe in the sense heavy lifting beyond their capacity. So they are trying to uh, do something beyond their capacity. Hence, the muscle they try to constrict to as much as they can. Hence, it can damage uh, the TM joint and can cause pain. Okay, so that is about Hanugraha. If there's anything else you need to ask about Hanugraha, you can. If there are any queries, more than welcome. No? Fair. So with this, we cover Hanugraha completely.